So till then, couple of housekeeping checks. So after this webinar, a webinar recording and the slides will be shared with all the attendees, and you will get a notification once it is ready and uploaded on our website. And if you can hear me clearly, like, I would request you to kindly type yes in the chat box window, so that we will come to know that yes, we are audible properly. Throughout our presentation, we encourage you to interact with our speakers and by typing the questions and comments using the question pane, and we would be happy to take the questions at the end of our webinar. Also, you can use hashtag IoT Healthcare to promote the webinar or ask questions on Twitter. At the end of the webinar, we have a very exciting offer and special offer exclusively for our webinar attendees, and you can stay tuned and you can wait for our webinar, and at the end of the webinar we will disclose the special offer for all the attendees. So it's a surprise right now. Okay. So I think we all are set now. So first of all, on behalf of Harbinger System, a warm welcome to all of you, and good morning and good afternoon. My name is Pankaj Ojha. I'm working with Harbinger as General Manager Projects, and I'm basically heading few healthcare projects and initiatives at Harbinger. I have with me my fellow colleague Pulkit Kapoor, who will be the co-speaker, and Pulkit was health domain knowledge of US health. IoT is transforming healthcare ecosystem. We will take few examples in these. And end of the webinar, we will be taking up the questions that all attendees may have. In case we have more number of questions, and if we are not able to take up the questions in the limited time, we will surely take up those questions offline, and we will upload all the question answer on our websites, and you will get notification once it is ready. Okay. So healthcare ecosystem. So healthcare ecosystem is quite complex and big. It consists of several components and entities, and it's not easy to fit everything in one single diagram. Sorry. So to keep it simple and aligned with our today's topic, we have drawn a very simple diagram. So from a very high level, the healthcare ecosystem revolves around three important entities and core components, and these are patients, providers, and payers. So we call it as a 3P model. There are several other entities also, like the government and regulatory bodies, pharmaceuticals companies, medical labs, clinics, public health, ACOs, and many more. And in next slide also, as we will proceed with the webinar, so in next slide also, our discussion will revolve around these three important entities only. So we will talk mainly about the IoT and the healthcare related to patient, providers, and payers in general. So this was about the healthcare overall ecosystem. If we talk about the healthcare market potential, so after years of like the relatively steady increase, the growth rate in American healthcare spending is accelerating again, which is a good news. As per a very recent report, so we saw that the healthcare spending grew twice the economy. So healthcare spending grew 4.9%, whereas the economy grew by 2.3%. So that way we can say like the healthcare spending have a very good scope, and like it's also another angle is like it's very costly also. In 2007, the spending on healthcare in the United States was around $2.3 trillion. In 2014, it reached and touched $3 trillion. In 2015, this year, it is expected to cross 3.2 trillion, and by 2024, it is expected to reach or even cross 5.4 trillion. So overall, we are seeing a very good and positive market trend as far as like the US spending in healthcare is concerned. So it's a good thing. Also, like as per a recent report, it is expected that the healthcare spending will reach around $10,000 per person a year for an average American. So overall, we are seeing that as like the spending is increasing, even the cost for like the patients and everyone is increasing. So there is like this is good as well as like bad news, and like we need to take some actions. We will see like okay, so how and what should be done. So before we move to understand the IoT in healthcare, it is very important to understand the current market need and why we need something like IoT in healthcare, why it is needed. So as I mentioned earlier, like the healthcare ecosystem is quite complex, unsustainable, and too expensive. It's eating around 18% of our national GDP, which is big, quite big. But the good news is US healthcare system is evolving, and the national and the traditional model is changing, and it is ready to accept the new innovative ideas and changes. At the heart of this innovation is patient engagement. We will see like okay, so how patient engagement is very, very important, and like how it will affect the overall ecosystem, healthcare ecosystem, which revolves around payer, patient, and providers. So as per the 3P healthcare ecosystem we discussed, we will take two cases or like two types of engagement model. We will talk about consumer payer engagement, and we will talk about patient provider engagement. And with these two, and we will take few examples to understand that how these engagement models are important. So if I have to we have to talk about the consumer payer engagement, so we will see like okay, so how payers are engaging patients and consumers. So initially payers launched apps as payer portals, and then they added wellness features to it. Some of them even moved further and allowed a user to set goals, import data from other wellness and fitness apps. They even allowed users to track eating habits. Some of the payers portal and applications also allowed gamifications and added gamification features where one can challenge other, and then they can get points and then rewards to it. So all this helped promote user interaction and physical activities, which ultimately help payers, because if the patient or the consumer is like well and healthy, so ultimately it affects in a very positive way to payers. So this was good to some extent, but a big challenge for payers is to encourage user adoption of these newer offerings. As per a report, 65% of the consumers have yet to use an insurance app. So this indicates that payers need to have a more effective patient engagement service and technology. So the current system of like the patient app and portal is not that effective, so they need a change. Similarly, if we talk about providers patient engagement, so they're also like the providers are facing challenge. As every patient is unique in their own way, it's not easy to engage them very frequently and easily. So the current model is changing from fee for service to fee for outcome or quality of care. So expectations are more. Providers are having hard time due to scattered patient data into multiple systems and with multiple parties. Also, providers are facing challenge due to shortages of caregivers, infrastructure limitations, and over 80% of medical errors due to miscommunication of lack of coordination. And a good amount of time is wasted during any treatment in collecting data, getting all the historical details and preliminary evaluation. Also now patients are more educated and smart, and patients now want to get involved into the decision making of or all their health related decisions making. So involvement of patient is also now a need that provider should consider. So overall, we are seeing that the current healthcare landscape is not sustainable, and there is need for innovation to deliver better and more affordable healthcare. So the solution for most of this problem is use of Internet of Things in healthcare. We can also say that IoT is going to be a healthcare game changer. So the main challenge that we discussed so far is patient engagement. So educating patients, keeping them engaged and motivated, reminding them for data or regular checkups. It's not that easy, because like there are millions or like thousands of millions of like the patients, and they may not have time for like regular checkups, or it's not easy to get hold of like everyone at the right time. So patient engagement is not that easy. So all this is like pull mechanism, which is somehow it's not working. So in this case, what happens is like once someone is facing some problem, or a patient is like facing a problem, then they will go to doctor, and then the checkups will start, and then the doctor will notify if there is any problem. So somehow this is not working, and the demand is for a push mechanism. So in push mechanism, what will happen is like if as a patient, if I have any problem, then ultimately like all the data from me will get transmitted to the system, and ultimately it will reach to my caregivers or my physicians, and they will get the real-time updates and the data about me. And then based on the data what they will be receiving, so they will be able to inform me, they will be able to give me right treatment at the right time without waiting for me to go to hospital, go to clinics, get all the reports or like the lab reports generated, and then make a conclusion that what kind of treatment or like the problem I have, and then start the treatment. So it will be like quite good idea to get all the patient generated data directly from patient itself, instead of collecting from several abnormality or any change in data about their health. So they will be quite aware and updated, and they will have a buying in the health decisions related to them. So overall, with this model, what we are seeing is like we are seeing a very improved patient engagement, because here like the patient will be very much aware of the health decisions, and the doctors will also be able to notify them about any problem or any good or positive or negative things happening in their body. Apart from this, like the other advantage is like identifying patient need and provide tailored services, as like the data will continuously feed into the system. So basically there will be a good amount of data, and they are using a good data analytics system. The physicians or the caregivers will be able to see all the historical data, and with their preliminary evaluation, they will be able to take the right decision at the right time. So this will also help physician to give a tailored and customized service or good service to their patients. Also, as we saw, like the 80% of the problems are because of like the miscommunication. So with this, because of like the manual communication and all. So basically with this automated system, as the data will get transmitted from one system to another system, so there will be almost no manual intervention or very less manual intervention. So the communication gap won't be there. So the right data will go from one system to another system, and then the manual error will be very low or very less. Also, as all the historical data and the real-time data will get transmitted from one system to another system, so basically the decision making will be very strong and better. Apart from this, through our examples, we will see how it is reducing the healthcare cost. But to just give you an example, as my data will get transmitted to physician real time, so basically physicians will be able to see or like monitor my health remotely also. So as a patient, like I won't have to travel or get admitted to hospital. So it will be quite cost effective solution. Okay. Mm, okay, so before we move to this slide, one more thing, like, okay, so we just missed to talk, like, okay, so if we have to define what exactly is like the Internet of Things, then in a very straightforward definition, so Internet of Things is the network of devices and sensors which we use in our daily life, and the data they produce, gathering, storing, and processing of that data to make right decisions for right engagements more productive and successful. And if I have to give few examples of IoT devices in healthcare industry, so few examples could be headsets that measure brain waves, clothes with sensing devices, wristband, BP monitors, glucose monitors, ECG monitors, pulse oximeters, or even a smart pill bottle that reminds you that you missed a dose of a medicine, and keep track of the medicines, that how frequently or are you taking the medicines at right time or not. So these are few examples of the Internet of IoT devices in healthcare. Okay, so as we defined, like, okay, so what we mean by IoT in healthcare, and we saw a few examples, and also like we all saw the importance, like, okay, so how getting data generated from patient themselves and getting it feed into a system where physicians or caregivers can study the data, get the historical details, and then take the right decision. So, but just getting patient-generated data is not enough. The data generated by these devices will be raw, unstructured, and unpredictable in nature. So, it is very important to bring together patients' health data, their preliminary evaluation, and combine it with a very good big data analytics system, which will ultimately generate some actionable insights, and then only the whole setup will be effective. So what happens is, like, the patient's preliminary data, the patient historical data, and it will all get fed into the data analytics system, and the data analytics system will be smart enough to see the trend and then accordingly predict the right set of actions for that patient. So this will ultimately help physicians or caregivers to take the right decisions about that particular patient. Okay, so let us take a couple of examples to understand how IoT in healthcare is helping. And as we saw, like, few advantages like the cost-effective or better patient communication or engagement and all. So we will see it through a couple of examples. One example we will take is like for outpatient, and one example we will take for inpatient. So in this example, what happens is, like, suppose like there is a patient, and like the patient is admitted to hospital. So, or maybe like a patient is discharged or like the treatment is done, but doctor wants to keep the patient for observation for some time. In the absence of the IoT devices, what happens is you need to get admitted to hospital. But here what happens is, suppose like a person or the patient have few IoT devices, suppose like a wristband or like through sensors attached to this person's body. Then what happens is this person continuously sends the data to the cloud and the overall physician system, and even without even not being present in the same room or like the same premises, the doctor can easily monitor the health and the improvement for this patient and accordingly take the right decisions. We will take one example. Suppose like a scenario where like a patient is relocated to some other county or city, and still he wants to be in touch with his old physician. So what happens in this case is like through an IoT device, which is ultimately connected with the Wi-Fi, and then from Wi-Fi the data reaches to cloud, and from cloud the data reaches to the physician or the hospital's database. So in this way also, like the page, this is an example of remote patient monitoring. So even if the patient is not located in the same hospital and the patient is at home or somewhere else or far away, it's still like the data about this patient is getting transmitted continuously to the system, and the private caregiver or the physician will be monitoring it, and they will be able to take the right decision. Suppose like if I have some easiness in my chest, and suppose as a patient I ignore the problem, but as my data is getting transmitted continuously to my physician, so they will be able to see the symptoms and they will be able to inform me and give me a call that, hey, the problem that you are ignoring is not easy, or like it's a very serious one, so you better get in touch with the physician or get the treatment done very quickly. So this is like one example, like because of how use of Internet of Things in healthcare is helping inpatient and outpatient. So with this, I will hand over the rest of the webinar to my co-host Pulkit, and he will take you to the rest of the presentation.
Thanks, Pankaj, for explaining us the in-depth of IoT into healthcare, and what are with the help of the use cases, the examples of clinical care as well as remote patient monitoring. Now we are going to talk about how IoT is transforming healthcare industry. What are the various initiatives which are involved into healthcare industry, and how it's post-Obamacare, what are the changes which have come into healthcare industry. So to start with, I'll first start with the traditional versus new model. So our traditional model at our country is, when a problem is detected, then the diagnosis parts come into picture, and a proper treatment or those kind of treatment is given by the provider or by our hospital. So this was a traditional model, a very simple 3-step model. But in last couple of years, or I'll say that post Obamacare, we have seen the entire model got changed, and this new model consists of preventive care as well as wellness and fitness activities. So what is this preventive care is all about? So this is nothing, if a patient has suffering from diabetics, so he may have a set of some guidelines from his providers or some program health plans from his health insurance company or his payers, and these preventive activities will help the patient in order to improve their vitals. So he may able to get cured within less interval of time. But in case a diagnosis comes into picture, or some disease is diagnosed into a particular patient, a proper treatment, a proper inpatient treatment or outpatient treatment is given to the patient, but it is again followed by the wellness and fitness activities. So these wellness and fitness activities may be gym classes, maybe yoga classes. So these different types of programs are offered by the wellness companies or by our insurance providers, that is payers, or maybe sometime by our hospitals or providers. So this is the entire transformation has been shifted from the traditional model to this new model, and this new model is much focused on preventive care as well as on wellness and fitness activities. So next we will talk about the preventive care in depth. So when preventive care comes into picture, so a person can monitor various activities, for example walking, running or swimming, with the help of. So these devices are nothing, maybe a wearable wrist device, or maybe a wrist band, or maybe a device, a holding device. With the help of these devices, a person can monitor various activities. So I would explain this with the help of an example. So a person called Mr. Bob is there, and every morning he is a working professional. So every morning he goes for a jogging or a running. So it is observed that when he is running 20 minutes a day, so throughout the day he is very happy, and he is very active at his work. So how this 20 minutes come into picture is with the help of my wearable device, or that is an IoT device. So Mr. Bob has this IoT device through which he monitors how many miles he ran and how much time he is doing jogging or running. And this data, this data, a week's data or a month's data is captured into the database of that IoT device. And that data will produce the output that Mr. Bob, if you are running for 20 minutes in a particular day, your day is healthy. So, we approach to such kind of number so that Mr. Bob will take care that every day he is doing jogging or walking for maybe for 20 minutes. So, these kind of initiatives or, this kind of new enhancement we have seen into preventive healthcare industry. Then we will talk about chronic disease management. As we are aware that 50% of our, country's population is facing from any one of the chronic disease. It may be obesity, it may be cancer, it may be, any cardiological disease, or maybe diabetes. So in order to monitor those chronic disease, we do have, couple of devices already available in the market. And these devices, as we can see in the pictures, a wristband is there, a glucose tracking, a blood sugar tracking device is there. Then these devices are connected with my mobile app or with my portal. So when they are gathered with the help of these devices, it gets stored into the portal or the mobile app, and the mobile app consists of some set of rule engine is there, or analytics part, data analytics part come into picture, and it will produce a fruitful output. So what is this fruitful output? Is nothing but monitoring the vitals. So let's take an example over here. So a health insurance company offers some chronic disease management program, maybe related to obesity. So that program is for 2 weeks. So at the starting of 2 weeks, Mr. Bob recorded his vitals with the help of the IoT devices into this portal. And once he is able to complete that, the training part or the program, wellness program, after 2 weeks, he is recording the vitals again. So based on this recording, the data analytics which come into picture, and it will produce the report card, the final report card which will be produced post training, and how much effect and how much beneficial this training was, it can be measured with the help of the data analytics, and a proper output will be produced. So now I'll talk about some of the healthcare innovations. So these are some of the examples which we have seen into healthcare industry. Now various ISVs, the startups, and various new companies are coming up with some new ideas, and these new ideas do have some sensor technology or latest kind of technologies, and with the help of these technologies they are trying to come up with some new innovations or some new devices. And these devices are very helpful, or you will say that these devices are going to change the entire structure of our healthcare industry. So to start with, I'll talk about electronic bottles or pouches. So I normal pill bottle which we use has some sensor into it which is connected. So suppose I'll take an example. Mr. Bob went to his provider, and his provider gave him 10 tablets which he needs to consume in 5 days. That means that one tablet in the morning, another tablet in the evening. Morning 10 a.m. he need to consume, and in the evening 6 p.m. he need to consume. So all the 10 tablets will be there into this electronic smart pill bottle, and this bottle will be integrated with the wireless network. So suppose he took 4 tablets, within at 2 days he is taking proper, but on the third day morning he forgot to take his pill at 10 a.m. So a message or a pop-up or a automated call will be there at 10 a.m. on his mobile that you have missed a particular tablet or the pill in the morning. So this will help Mr. Bob to track whether he is taking the medicine on time or not. So this was a very recent example, a new initiative in healthcare industry, which is as the figure is suggested, you can see that the mobile device is there. If the mobile dosage is taken on time, so it's good, it's perfectly fine. If a dosage is missed, an alert or an automated call will be there on the mobile, and it will inform Mr. Bob that you have missed this tablet, so maybe you can go ahead and take the tablet. So the next example is of smart watches. So these smartwatches is, or the pebble watches is, I'll take an example with the help of an example that is pebble watches. And in this pebble watch or the smartwatch, a person is able to, send or a patient is able to send urgent messages or alerts to his provider. So as we all are aware of ACOs, that is Accountable Care Organization. So in ACOs, a provider is there and couple of patients are there who are connected with this particular provider. So in case of any emergency, in case of any alert, a patient want to send a message or a pop-up to his provider, he can just shoot up a message with the help of his smartwatch or a pebble watch, and a message will be given to the provider, and provider can respond or connect back to the patient accordingly. At the same time, this communication is not one-way communication. It's a two-way communication. Providers can also approach to the patient. So suppose in the month of October or November, when winters are coming, provider want to give some suggestions to their patient or the group of patients. He can send a pop-up message or a broadcast some message which will consist, maybe related to diabetics or maybe related to any other disease. And this pop-up or a message will be given to all the patients or all the members which are using that device. So at the same time, these smartwatches also help us, the providers to give the prescription part. So what is this prescription part? So suppose in remote patient monitoring, as Pankaj already explained, so a patient is there in another county and a provider is there in some other county. But the provider want to give some prescription with the help of a smartwatch. So he will just open his smartwatch app, and in that app he can select the frequency of the tablets and the dosage, the quantity. So maybe, as the figure suggested, that a tablet is there at 10 a.m. in the morning, then 1 p.m., then 8 p.m. So, thrice a day the patient need to take the tablet. So in this manner, a provider can give the prescription, the e-prescription part to its patients. So next we are going to talk about the challenges. So as we have seen, a couple of innovations into healthcare industry which are there with the help of IoT. So again, our healthcare industry is facing a couple of challenges in order to implement, come up with new service offering or a product offering. So when it comes to IoT, if ISV or a new, a company is there, he want to develop a product or a service offering in healthcare IoT space. So a couple of challenges he is facing. So we will talk about these challenges in detail. Sorry. So first challenge, the very basic challenge is security and privacy. So I'll explain this with the help of example. So suppose a ISV is there and they want to come up with an application or a device which is related to maybe diabetics. So a device is there and a web portal is there which is integrated with that particular device, and the data analytics part come into picture. So whenever there is a transmission from one device, whenever there is a transmission of data from one device to another device, it must be encrypted. So it must be, it follow the HIPAA compliances or the COBRA compliance, which are already there by CMS. So they need to take care of each and every, compliances in order to build any portal, any mobile app, or any, device integration. Then the next challenge is about healthcare reforms and mandates. So this is again very important thing which we need to consider. For each and every, disease or portal, there is a mandate from CMS. Again, if I talk about diabetics, so there are some set of rules by CDC which says that they need to, encounter with a patient in a particular manner. So that manner or that measure should be kept in mind while developing, or while coming up with new offering or with new idea. Another challenge, the most important challenge is technology adoption. First of, sometimes it's related to hardware. As we have seen, electronic pill bottles or, the smartwatches are coming up in the market. So is the industry or is the healthcare providers or the payers or the patient or the 3Ps are able to adopt those changes or not? Are they able to, invest that much of amount, as the investment is quite huge into this sector? And at the same time, there are some, some technological challenges like interpolability. So how the data will, transfer will take place between various devices, and how it's going to affect the entire ecosystem, our the 3 P's which Pankaj has already mentioned. So now we are going to talk about the road ahead. So what is the plan in coming couple of years? What is the plan of 2020? And what are the the various ISVs are coming up with this new ideas and new innovative in this area. So the recent stats from some research companies suggest that IoT will add $1.9 trillion to global economy by 2020. So this is the entire IoT, the Internet of Things. But if we talk about healthcare IoT only, that's a big amount, a huge amount is there. That is $117 billion. So this segment, as you can see, the potential, a huge segment is there. And various ISVs, the startups, they are coming up, they are coming up with new ideas, new innovative ideas, and building the entire service offering or the product offering. So there's a research which says that 30 billion devices will be available in the market, and 44 billion people will be using this 31 billion devices by 2020. So if I take an average, so it says that 8 devices per person. So one American will be having 8 devices by 2020. Watch, it can be a fuel band, or it can be a glucose tracking device, or a BP tracking device. So as we can see the figure, so huge number of investment is coming up in this area. So some new technologies, that is the sensor technology, data analytics, and healthcare structures are coming up in this particular segment. And these sensor technologies and biometric sensor technologies are enabling the IoT factor into healthcare industry. So recent example we have seen from Google X project. So this project, this make use of nanotechnology and monitor the cancer level in a particular patient. So it helps with the help of a nanotechnology, some sensors are there which are going to detect the cancer in a particular patient. So with the help of this project, this is some very recent project from Google, in which they are coming up with the IoT flavor, healthcare IoT flavor, and detecting the stages of cancer in a particular patient. So it may be possible with the help of this project, a person is able to detect his cancer level at earlier stage. So now it's time for the special offer. So this offer is all for all our attendees. So you can validate your IoT healthcare idea which you have with you, and we are going to provide, a Harbinger system is going to provide you 2 hours of free consultation. So you just need to do write up a mail or shoot a mail with your idea to hsinfo@harbinger.com to avail this exciting offer. So we will immediately connect with you and provide you 2 hours of free consultation today. So you can shoot out the mails. So now we will be taking questions from the audience now. I remind you once again, if you have any question, please. And if you due to time constraints, we are not able to cover all the questions, we are definitely going to send you the Q&A document along with the video which covers all the answers, question and answers which are raised today. So I would request you to please type in the questions in the question pen. So we have a couple of questions. So our first question is, do Harbinger have expertise in healthcare IoT?
Okay. To answer this question, yes. In Harbinger, we have experience and expertise in healthcare IoT, and in the past also we have successfully delivered healthcare IoT projects, and currently also we are working on a few exciting healthcare IoT projects. So we do have experience and expertise in developing healthcare IoT applications. if you allow me to add one more point, then yes, apart from IoT healthcare applications, so Harbinger also have good healthcare project experience where we help patient and creating patient and provider applications. Some examples are like EHR system, meaningful use certification, US healthcare compliance systems, or maybe healthcare related mobile apps or patient provider engagement applications and all. So do understand this space, and uh, we have expertise and experience. Okay, so we have next question from Mr. Dikoko, and the question is how IoT in healthcare is relevant for developing countries. So for developing countries, especially like the one big challenge for them is the cost that a patient have to bear for the medical treatment. So here with of IoT, what will happen is like as I discussed in my example, suppose like there is a patient and after treatment, doctor wants to keep that patient for observation. So in the absence of IoT devices, the patient will have to get admitted to hospital, and if doctor wants to keep that patient, if doctor wants to observe that patient for 1 week, then that person will have to stay and get admitted in hospital for 1 week, and then doctor will do the regular checkups and all. But in case or in the presence of IoT devices, even if the patient is discharged and at his home, the data is getting transmitted real time with the doctor. So without any further cost or very minimum cost, the doctor is able to get the data from of patient and take the right decision. So this is like one example, and apart from this, like be it like remote patient monitoring, be it like for inpatient and outpatient. So IoT devices are also helping physicians taking right decisions. So by right decisions, like yes, this is again a cost effective. If we have to do several analysis, or like we have to do several checkups, and we have to pull the data from different systems and different parties. Again, this is little costly. So I would say yes, this is quite cost effective, and this will definitely help even for developing countries.
So Pankaj, we have next question on one of our challenges, that is how the security of the data transmission between various stakeholders being taken care of. So would you like to answer this question?
Yes. So here, like as you explained, Pulkit, like there are like the compliances and the security is very important. And as like we saw, like the federal rules are there, the rules from CMS and all are there. So it is very important to transmit the patient's data from one system to another system in a very secure and secure way. And if we violate, so that will be like a big penalty, and like it's not allowed. So the data, some examples of security could be like the data encryption, as you said, like the HIPAA compliance, or like if there is any mandate from like the CMS or like the from the state government, then those kind of encryptions and like standard format data transmission in an encrypted way is important, and we understand this space. So that is something we will take care, or we take care, or one need to take care while transmitting data from one system to another system. Okay, so we have one question: how biomedical sensors contribute in healthcare IoT from one of our audience?
Yes, Pankaj. So to answer this question, I'll say that most of the medical devices, they do have some sensors with them. So by making use of these sensors, the data is captured and transferred to a particular database, from where the data analytics part come into picture, and the post data analytics, a fruitful output is produced, which is consumed by either by the patient or the provider, and in order to be good amount of healthcare is given to that particular patient with the help of these sensor technology. So this is something new which is coming up in the market, and various ISVs, they are coming up with new various ideas which are related to sensor related technology, and they are making new offerings, new service offering in this particular area.
Okay, so we have time for one more or one last question. So here we have one question from one of our audience. Can we monitor running or walking behavior of a cardiac or cancer patient with the help of smartwatches or IoT device?
Yes, with the help of IoT device or the smartwatches, we can definitely monitor the walking, running, or the fall behavior of a patient. So thereby, again, monitoring the various different type of behavior, as I have already explained in the example from, the chronic disease management. So with the help of it, they do the data analytics part, and thus resulting in the, healthy healthcare or, improving healthcare system. So again, just a reminder to all the audience that you have this special offer today. You can validate your healthcare IoT idea, and you will get 2 hours of free consultation from Harbinger system today. You just need to shoot up a mail with your idea to hsinfo@harbingergroup.com to avail this exciting offer. Today's webinar is being recorded, and everyone will receive an email with the link to view the recording of the event along with the question and answer document. Also, don't forget to avail this offer, validate your IoT healthcare idea, and get 2 hours of free consultation today. With this, we will conclude our today's session. Once again, thank you all for joining us, and have a great day ahead.